Welcome to Have More Babies. Today we're tackling something lots of parents deal with, especially if you've got kids who love the water. Swimmer's ear, or the more technical term, otitis externa. Yeah, our goal here is simple. Get you the solid info you need fast. We want you to really understand it, know how to manage it, and maybe even prevent it next time.
That's the key, really, because it's often misunderstood. It's not just, water stuck in the ear. It's actually an inflammation, sometimes an infection of the outer ear canal. That's the tube leading from the outside to the eardrum. And what's interesting is how it happens. Basically, the ear's natural defenses get, well, compromised. We're going to break down the causes, what symptoms to watch for the real red flags, and how it's treated and prevented.
Okay, let's unpack that compromised defense idea. Why does it happen? It's more than just swimming, right? What are the actual roots of this problem?
Right. The ear canal normally has this slightly acidic environment plus earwax or cerumen, which acts as a barrier. The number one cause, what we call water retention, messes that up. Lots of swimming or just long exposure to water, it softens the skin inside the ear that's called maceration, and it changes the pH level, makes it less acidic.
So it becomes a better place for bugs to grow.
Exactly. A perfect, moist, sort of neutral environment for bacteria or even fungi. Then the second cause, and this one's huge for parents to understand, foreign bodies. Usually this means some kind of tiny injury, mechanical trauma, and the most common thing, cotton swabs.
Still,
Yeah.
even after all the warnings.
Yep. Sticking anything in there, even gently, can create tiny scratches, microabrasions, and those are like open doors for germs.
That difference is important. The water changing the environment versus actually scratching the surface. Are we maybe too focused on the water part and not enough on the cotton swab injuries or things like chemical irritants?
It's a balance. The mechanical damage from a swab is instant. Chemical irritants, that's our third point, are things that strip away that protective wax. Think harsh soaps, shampoos getting in there, maybe even overusing some types of ear drops. And finally, number 4, sometimes underlying skin conditions are involved, like eczema or psoriasis. If that affects the ear canal skin, it's already weakened before water or anything else gets involved.
Okay, so the barrier breaks down one way or another. What happens then? What are the first signs parents should look for?
Well, it often starts pretty subtly. The earliest thing is usually just itching.
Just itching, like if the kid keeps rubbing their ear.
Exactly. That's often the first clue. Then it can progress. You might see some redness inside the canal, maybe some swelling starting. But here's a really key thing that helps tell it apart from, say, a middle ear infection. The pain. Specifically, pain that gets worse when you touch or move the outer ear.
Like pulling on the earlobe.
Yes, or pressing on that little flap of cartilage right in front of the ear canal, the tragus. If that hurts sharply, that points strongly to otitis externa, the outer ear canal being inflamed. If it keeps going, you might see discharge, some fluid, or even pus coming out. And because of all that swelling blocking the canal, you can get temporary hearing loss.
Okay, so itching, redness, pain on touch, maybe discharge, hearing muffled. That makes sense. Now, when does this move from annoying to we need to call the doctor right now? What are those absolute red flags?
Right. This is where we need to be really clear. There are 5 key things. First, persistent pain. If the pain just isn't getting better after, say, 48 hours, even with some Tylenol or ibuprofen. Second, drainage. Any fluid leaking out, especially if it's continuous or looks like pus, that's a definite call the doctor sign.
Okay.
Third, swelling or redness that's spreading. If you see redness or swelling moving outside the ear itself onto the skin behind the ear, for example, that could mean the infection is spreading in the skin, like cellulitis.
What about fever?
That's number 4, fever. A temperature over 101 Fahrenheit orally, or maybe 102 under the arm. That signals a more systemic reaction. And the 5th one is rare, thankfully, but serious. Any signs of really severe deep infection, especially intense pain that seems way out of proportion. This could hint at something called malignant otitis externa, particularly important in kids with weakened immune systems.
Wow, okay, so if we see any of those, we get help.
Yeah.
What happens then? How does the doctor figure out for sure it's swimmer's ear and not something else, like a middle ear thing?
Yeah.
What's the battle plan for diagnosis?
It usually starts with a good look using an otoscope. That's the clinical examination. The provider is looking for that redness, swelling, maybe debris in the canal. Crucially, they're also checking the eardrum, the tympanic membrane. They want to make sure it looks normal, not bulging or red, which would point more towards a middle ear infection, otitis media.
So they're looking in the canal, but also checking the eardrum beyond it.
Exactly. Now, if the infection looks really bad, or if it keeps coming back or isn't responding to the first treatment, they might do a swab test.
To see what's actually growing in there.
Precisely. They take a little sample of the discharge or debris to culture it. This tells us if it's bacteria and what kind, or maybe fungus, which needs different medicine. And sometimes, though less common, if hearing seems really affected, they might do a quick hearing test.
Okay, that makes sense. So, diagnosis confirmed. Let's talk treatment. What's the strategy? What are they trying to achieve with the medications?
It's usually a two-pronged attack. First, kill the bug, the bacteria or fungus. Second, reduce that inflammation and swelling, which is causing most of the pain. The main tool for this is usually medicated eardrops. So antibiotic eardrops are very common, often a type called fluoroquinolones, to fight bacteria directly in the canal.
Right.
But just as important, especially for getting quick relief from the pain, are corticosteroid drops. These are specifically to bring down the swelling and inflammation.
Ah, and that helps the antibiotic get in deeper too, right?
Exactly. If the canal is super swollen, the antibiotic drops can't even reach the infected skin properly. So the steroid helps open things up. And of course, simple analgesics like Tylenol or ibuprofen help manage the pain while the drops start working.
Okay, so drops are key. But getting them in right, especially with a squirming kid who's in pain,
Yeah.
that seems tricky. Are there specific tips for making sure they actually work?
Yes, technique is absolutely critical for success. First off, sometimes the canal is just too blocked with gunk or swelling for drops to even get in. In that case, a doctor or nurse might need to gently clean or suction it out first. You can't put medicine effectively onto a pool of pus or debris.
Okay, that makes sense. Sometimes a professional cleaning is needed first.
Right. And for really severe swelling where the canal is almost closed, they might insert something called an ear wick. It sounds odd, but it's basically a tiny compressed sponge.
A sponge.
Yeah. They put it in the canal, and then you put the drops onto the wick. It absorbs the medicine and keeps it held right against the swollen skin, ensuring it gets absorbed even when the canal is nearly shut.
Okay, clever. But for regular home use, just putting the drops in.
For home use, consistency and technique are everything. First, warm the bottle slightly just by holding it in your hand for a few minutes. Cold drops can make you feel dizzy. Then, get the child lying on their side with the affected ear up. Gently pull the outer ear to help straighten the canal. Pull it sort of backward and upward for older kids or backward and downward for little ones.
Straighten the path for the drop.
Exactly. Then, put in the prescribed number of drops, and this is vital. The child needs to stay in that position for a few minutes afterwards. Like 4 or 5 minutes is great. This lets the drops soak in properly down the canal.
Not just drip in and roll right back out.
Precisely. And sticking to the schedule, doing it as prescribed for the full course, is the biggest factor in getting it cleared up quickly. If things aren't improving after, say, 2 or 3 days of doing it right, that's when you need to check back with the doctor.
Got it. Consistency and patience. Now, let's shift to prevention the defense tactics, especially for families with little fish who are always in the water. What can we do proactively?
Okay, prevention is key. Number 1, mechanical barrier. Use well-fitting earplugs when swimming. Seems obvious, but it really helps. Number 2, keep avoiding irritants. That means, seriously, no more cotton swabs in the ear canal. And try to limit shampoos or soaps getting directly in there during baths.
Right.
Number 3 is all about thorough drying. After any water exposure, swim, bath, shower, get that moisture out. A great trick is using a hairdryer on its coolest, lowest setting. Hold it about, 4 to 6 inches away from the ear opening and just gently blow dry for a moment.
Cool air, not hot. That sounds like a good tip. What about that homemade drops recipe people talk about, the vinegar and alcohol one?
Ah, yes, the preventative mixture. It can be very effective because it helps dry the ear and restore that protective acidity. It's simple. Just half rubbing alcohol and half plain white vinegar.
How do you use it?
Just put 3 or 4 drops in each ear after swimming or bathing, once the ear is as dry as you can get it. The alcohol helps evaporate remaining moisture, and the vinegar brings back that low pH that bacteria don't like. But, and this is incredibly important, there's a crucial warning. You absolutely should not use this mixture if your child has ear tubes, or if they might have a hole in their eardrum, a perforation, or if their ear is already hurting.
Okay, so only for healthy, intact ears, purely as prevention after water exposure.
Correct. It's for prevention only in ears that are currently fine. For just keeping water out during a shower, an easier trick is a cotton ball lightly coated with petroleum jelly, placed gently just in the outer bowl of the ear, not pushed into the canal.
Good tip. Okay, the big question for swim families. The infection's cleared up, the kid feels better. When can they get back in the water?
There's one main rule here, and you have to stick to it. The ear must be completely free of pain. Any lingering pain means there's still inflammation or sensitivity.
No pain at all.
None. Pain is the signal the ear isn't fully healed. And even then, it's really best to check back with the doctor for a quick look to confirm it's all clear, no more swelling, no discharge.
Why be so cautious if they feel fine?
Because that ear canal lining is still delicate after an infection. Jumping back into the water too soon, even pool water, can easily reintroduce bacteria to that vulnerable spot, and boom, you get a relapse, often worse than the first time. Generally, you're looking at maybe 7 to 10 days after all symptoms are gone before it's safe to swim again.
Okay, that makes sense. Wait for zero pain, get the doctor's okay, and understand that healing takes time. So wrapping this up, what's the main takeaway here? It seems like understanding that protective acid mantle is key. Knowing those definite red flags for when to seek help, and then being really consistent with treatment and prevention, like using that vinegar mix safely.
That sums it up well. And maybe one final thought. Really getting clear on the difference between this outer ear infection, otitis externa, with that key pain on touch symptom, versus a middle ear infection, otitis media, which presents differently. Knowing the difference helps get the right treatment faster.
Absolutely. And for anyone wanting more detailed information or needing things like after-hours pediatric care, maybe access to specific care forms, or just wanting to book an appointment for concerns like swimmer's ear, you should definitely visit omegapediatrics.com.
That's the spot. Visit omegapediatrics.com. They have a lot of great resources there, care guides, information on all their services. It's really comprehensive.
And hey, if you found this conversation helpful, please do give us a like, subscribe to the channel so you don't miss future ones, and please share this with other parents who might need this info.
Thanks for having me. It was a good discussion.
Always great talking with you. Goodbye for now.